Good morning and welcome to Tuesday at 10 at Dunebrook. I'm Dr. Tammy Gerke-Button. I'm the Executive Director of Dunebrook, whose mission, every child safe, healthy, and happy, has been going strong for over 30 years through the prevention and intervention of child abuse. And I have the distinct pleasure of being joined today by Dr. Leah Osorio, a bilingual family medicine physician who works for HealthLinc in Valpo. She's a new mom to two little boys and enjoys sharing the gift of yoga with the community as a trained yoga instructor. She has also been on the front lines of this pandemic since day one. So thank you, Leah, for joining us today. I really appreciate your time on your off hours of patient care. Welcome. Thank you so much.
Thank you for having me. I'm very happy to be here.
Oh, well. Dr. Osorio is going to be such a resource for anybody listening with children. If you're a caregiver, she's got some great information to share with us. So tell us a little bit about your unique practice philosophy as a family physician.
Yeah. So family medicine in general, I think, is great when we're talking about keeping families healthy because we focus on preventive medicine. And also in my training, I've learned how to take care of pregnant women, and we're learned to take care of patients basically from womb to tomb. So all across the age spectrum.
Wow.
Yeah. And some of my favorite patients, I take care of their entire families. So in general, family medicine gives us a great perspective because we can really take into consideration the whole picture when we're looking at someone's care, and also consider their what they're coming through in their psychosocial context, which basically means beyond, does somebody have diabetes? Do they also what's their housing situation? Do they have access to food? That kind of stuff too.
Yeah.
I would say personally, so beyond that, I did an extra training after my family medicine residency where I learned how to deliver to lead group visits, which I'm very passionate about. Unfortunately, the pandemic kind of put a pause on that. But basically, I love to spend more time with patients in groups so that we can do more education. And I've also learned from my training that somebody who is living with the disease is in fact the expert on that disease. And so they teach their peers about different solutions. During that fourth year, I also did some training in alternative medicine. So I've learned a lot more about nutrition and how to work with different healing modalities like acupuncture, hypnotherapy, chiropractic care. And I also became a yoga instructor. So I really love, again, this holistic approach to health where we are taking into consideration mind, body, and spirit. So just to give an example of one of my passions, during the pandemic, we led a smoking cessation group virtually where we had group visits with people from their homes, so it was safe. And we talked about how to quit smoking, but much beyond the patches and everything, which are also very important. But we actually invited a hypnotherapist to come and talk, and she led a hypnotherapy session.
Wow. On Zoom?
Yeah, on Zoom, yeah.
Oh, that's fantastic.
Yeah. And then we did a lot of breathing exercises. And again, people who've tried to quit smoking multiple times before were able to coach themselves. So that's I think a great example of how I like to approach family medicine from a unique way. And the other two things I'd like to say that I offer at HealthLinc are I've started working more with the LGBTQ population, and I'm starting to prescribe hormone replacement therapy for people who are transitioning, as well as me and another provider at the Valpo office prescribe medication-assisted treatment for people who are struggling with addiction. So it's really important, I think, to look at all these different perspectives when we're taking care of a person as a whole.
Absolutely. That's amazing. Amazing. And I have to say, I had the pleasure of joining one of Dr. Osorio's evening yoga classes where she invites patients to have a yoga class with her, a group class. And so I got to do that a couple times from home, a Zoom, and it was a fantastic experience to just see everybody together like that and led by their family physician. I mean, that's incredible. And the things that you're offering, and, you know, with HealthLinc being that group practice, you know, you've got a lot of other resources that you can pull from there as well.
Yeah, HealthLink, we like to call it like a one-stop shop because when you come in, so we have a pharmacy there, which if ever a medication is not affordable through your insurance, we can get it at a discounted price. We have therapists, we have dental, we have eye doctors, and it's been great just seeing how the organization has adapted to respond to the needs of the community during the pandemic. So we've been really helping with testing and as well as vaccinating. So yeah. Come check us out.
Yes. Well, speaking of the pandemic, I want to say again, thank you so much for your work during the pandemic. And from, the beginning, you have been seeing patients and learning as you go, as you say. But what, from your perspective as a mother, as a family, and as a physician, what are some of the most important aspects of family health right now?
Yeah, I think if you would have asked me this before having kids, I probably would have had a completely different answer. Yeah. So, I'm so grateful for having children just because, I love them, but it's also really helped me as a family medicine doctor. And I've realized family health is not just doing what's best for one person in the family. You have to do what's best for the entire family. And I think right now, there is a lot of pressure to do certain things a certain way. And, it can be a lot, especially for new moms, figuring it out, like, learn how to introduce solids this way, make sure that you're not sleep training. Oh, but you should sleep train, like all these different conflicting evidence, factors. And I think it's really important to just figure out what fits best for your family and find balance. So, in general, when I think about having a healthy family, I really think it's important to monitor stress, right? So,
yes.
And to me, that means it can be just simple things. So getting outside, turning off screens, learning how to breathe, and just these simple things can go a long way. Other things, of course, for health and families is nutrition. And that is, I think, a topic where I continue to struggle feeling mom guilt about, because you can try the best you can to get your kids to eat healthy, but at the end of the day, you can't force anyone. You can't force a kid to do something they don't want to do. So, but I think it is important to continue to offer healthy foods. I like to talk to families about the 5-2-1-0 mnemonic. So 5 meaning 5 fruits and vegetables a day. And I always say potatoes and corn don't count. Okay. 2 meaning no more than 2 hours of screen time a day. And I think also if you want to do less than that, that's totally fine too. 1 for 1 hour of movement every day. And I think that can be really great for families to learn how to move together. And I didn't say exercise because I think sometimes we have this picture of what exercise is, but just moving. Yeah. And then 0, and I know this is something that you're very passionate about, but 0 sugary beverages. So no pop or juice.
Yes, thank you. Thank you.
So my kid loves water, but we just never let him taste pop or juice. So if you can just avoid introducing it, I think that goes a long way. Just because, sugar leads to obesity and cavities, which we don't want either. So yeah.
Yeah. And that, you talked about a lot of really good points there. And that rule that you just talked about too, that's a good one to remember, that mnemonic. Do you have any other resources that you like to share with families as far as online or social media or things that offer good evidence-based information and are easy to follow?
Yeah, so I might have some books that I'll just pull up right here.
Oh.
So this is one of my favorite books. It's by Leanne Brown. It's Good and Cheap, How to Eat Good and Cheap on $4 a Day. So
oh my gosh,
very worn copy because I look at recipes all the time in here. And what's cool is I don't think the book itself is very expensive, but if you buy one, she donates one. And you can also go online and just find the PDF. So if you don't want to buy the book. Then,
and the PDF is free? Mm-hmm. Oh my gosh, that's incredible. Wow. Yeah.
And so one of my favorite recipes is so I'm a vegetarian and I eat a lot of vegetables because they're my favorite. And they have cauliflower tacos in there. So
Ooh,
those are good and very easy to make. The other resource I have here in book format. So as a yoga instructor, I really feel like if it's yoga, if it's just breathing, if it's meditation, that is one of the biggest gifts we can give to ourselves and our kids is teaching them how to manage stress. Because that I think chronic untreated stress has led to a lot of chronic diseases, right? So if we can help kids reset their nervous system at a young age, I think, again, that can be an invaluable skill. So this is Itsy Bitsy Yoga, and I'm sure you can get it at the library, but I kind of have started already teaching my toddler some of these poses, and then this is the one for the older kids. But yeah. Other resources I love to talk to patients about. So Mediterranean diet has a lot of evidence to decrease cardiovascular disease, and oldwayspt.org has a lot of information on the Mediterranean diet pyramid. And it, if you have a different ethnicity or if you're a vegetarian, they have different pyramids that are specific to those groups.
Oh, nice.
Yeah.
Very nice.
And they have recipes and shopping lists and everything. The other thing I like to talk to patients about a lot is how carbohydrates are not all created equal, right? So I'm never going to say no carbs because, you know, I like a good cookie and carbs are okay. But it's trying to increase whole grains, which I think is a concept that is a little bit difficult to wrap our heads around because in the American diet, we don't eat so many whole grains. So the wholegrainscouncil.org has a lot of good information. Another great resource is Harvard Healthy Plate. It actually has like a plate out there showing you how to have half of your plate vegetables, fruit, a quarter protein, another quarter as whole grains. And again, I think as a mom, what I try to do is always, every time I'm offering a plate to my child, I will make sure there's one thing on there I know he likes, but I continue to put things on there that are healthy, trying to aim for the Harvard Healthy Plate, because they actually say a kid needs to taste something like 11 times before they might develop taste. So just continuing to offer, but I try to have meals not a no struggle time, right? And then the last resource regarding nutrition is Chop Chop is a great magazine that sometimes actually organizations can get for free, like a lot of them. So I wonder if that's something Dunebrook could look into, but it's really cool because kids are going to be more into eating healthy and exploring different foods if we allow them to also be part of the cooking process. And in addition, going and checking out your farmer's market can be great in the summer because, I mean, kids love to explore, and if they actually can see, you know, what the food looks like before it's cooked, I think that's also an important part of the learning process. And one more thing I was going to mention I lost my train of thought. Hold on. Pause. Sorry. Oh, farmer's market. Oh, yes. So sometimes this is going to sound really silly, but I just discovered frozen vegetables. Okay. And they're amazing. And I love cutting up fresh vegetables. I don't know. It's something kind of like you can get in the zone, but sometimes we just don't have time for that, right? And especially it can be more expensive getting fresh vegetables in the time of year when we don't usually have vegetables growing in this area, right? So frozen vegetables at Aldi are very affordable and super easy to make. And Imperfect Produce is another great resource if you want to get fresh vegetables, but maybe at a discounted price, because they actually will ship a box of fruits and vegetables to your house that would have otherwise been thrown out. So you get them at a discounted price. And when I say thrown out, it's not like you're getting like a rotten banana. They're okay.
Okay.
Then can I share a couple more resources or no?
Oh, please, please. Okay. Yes.
All right. So myplate.gov is a great resource for looking at different activities for kids, as well as say you're struggling with a picky eater and you want to learn different creative vegetable solutions. So then you can like go onto the website and look for stuff there. Then I love the library as a resource. So in general, it's really great to read to kids. So they have a cool program where you try to read 10,000 books to your kids before it's 1,000. Never mind.
I was going to say, wow, your library is really
1 million books
before your first birthday, right?
Yeah. You can do it. You might not think that's the only thing you're going to do for the year, but your kid will start talking by 1. No, but it's 1,000 books. And so I think that's just, something fun, and the kids can see their name kind of going across the board as they read more books. The library also has a lot of cool, just like crafts and stuff. And I'm so excited for when we can achieve more of a sense of normalcy again, because I think when we're talking about healthy families, we need to think about our families in a community, right? And so it's going to be great to be able to, utilize more of the resources at the library. The YMCA also has a lot of great resources, but I totally get it that we've kind of been having to just especially since little ones can't be vaccinated, we've all been trying to just socially distance as much as possible. So,
yeah. Do you have any good, for people that like to get good evidence-based information off of, let's say, Instagram, do you have any suggestions for good accounts to follow on Instagram?
Yeah. So, I got rid of all my social media, but there are some people that I know, for different things. So for example, for good resource for sleep, I do like Taking Care of Babies. Another good resource when we're thinking about introducing solids, Feeding Littles is good. And I don't know if Love and Logic has a social media account, but I did want to mention them too. So they offer free parenting classes, all based out of, really not fighting or yelling at your kids, and just offering more, kind of working as a team for discipline. So, and I know at the Y, my husband and I took the course for free. So that's another really affordable resource.
Okay.
Mm-hmm. And then I think one of my favorite resources locally is the dunes, right? And all of the great parks.
Yes.
Yeah,
absolutely.
So
you guys have a favorite trail?
Well, Coffee Creek, I know that's not part of the dunes, but that's actually where Tammy and I met what was that, 2 years ago?
That's right, yeah.
Yeah. Sorry. Okay. But I just think getting outside is such an important thing to do, and especially in the cold weather. So you bundle up. A trick for keeping your kids, their cheeks can get really red. I put a little Aquaphor on the cheeks, and that can help with the wind and stuff. So, but yeah, dressing in layers, and I think it's totally fine to go outside with your kids and get that fresh air. Yeah.
Oh, fantastic. Yes. Oh, you have given us so many resources, Dr. Osorio. Thank you so much. And your outlook, your positivity is just so valued right now. And of course, your continued work with seeing your patients and helping and all the things that you're involved with. Just thank you. A sincere thank you.
Mm-hmm. Thank you. And one other thing I just wanted to mention, if that's okay.
Absolutely.
Is so I think one of my favorite things that I've about being a doctor here is just I've made so many connections in the community. And so I've been working with a chiropractor so I can learn how to offer that to patients. And from you, I've learned so much about pediatric dentistry. And in general, I think it's important to just have an open mind and realize, especially as a parent and as a family, we're always learning things, right? You can try new things, find what works for you. And so I feel kind of silly saying this, but I had no idea how important it was to clean out a baby's mouth before they had teeth. So we kind of almost have a control study here, because for my first baby, before I met you, I didn't really clean his mouth before he had teeth. But now, since I've learned the importance of that with my new son, my younger son, we are definitely wiping inside of his mouth before he's even had any tooth developing, because again, you've taught me all about how important it is to reduce the bacteria count before the first tooth erupts. So I just think we should just all continue to learn from each other. And so no questions ever silly. So just feel free, just make sure you're getting information from the right people.
That is such a good point, because sometimes as a mom, you think that you should know certain things. And sometimes as a healthcare provider, people think that you have all of the answers. And like you said, it's collaboration, it's working together, it's constantly learning, because things are always changing. And, you know, hearing you say that, it's important for everyone to recognize that in their practitioner, that they do have somebody that is constantly learning and providing new information to them. And I think it's great that you were open to new information as well, as far as wiping your newborn's mouth out and learning how to do that, and being okay with saying, I didn't know this. And that's okay. That's really okay. Yeah.
So I think just trying to find a provider that helps you feel empowered to just work towards a healthier lifestyle, but remembering there's no perfect, there's no one size fits all. It's finding the balance and what works for your family. So, and we're all just trying our best here, right?
That's right. Every day, every minute of every day. That's right. Oh, thank you so much. And Dr. Osorio, like we said, is a family practice physician at HealthLinc in Valparaiso. So thank you so much for joining us today and for giving us all of these wonderful tips and all of these resources. So thank you so much.